Question 1. When performing chest compressions on an adult, what is the recommended depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters. This question focuses on the crucial aspect of chest compression depth for adults, which is key for high-quality CPR. The term recommended depth points to specific guidelines established to ensure effective circulation of blood. For adults, compressions must be at least 2 inches 5 centimeters deep but no more than 2.4 inches 6 centimeters to adequately pump blood to the brain and other vital organs. Imagine trying to get enough blood moving in a large body. A shallow push simply isn't enough. Always remember to push hard and deep for adult CPR. Question 2. What is the first and most important step you should take when approaching an emergency scene? A. Check for responsiveness. B. Call 911/activate EMS. C. Ensure scene safety. D. Begin chest compressions. Answer: C. Ensure scene safety. This question tests your understanding of the immediate priorities in an emergency situation. The phrase "first and most important step" emphasizes that your safety, and the safety of others, always comes before rendering aid. Before you can help anyone, you must ensure the area is safe from hazards like traffic, fire, or unstable structures, as an unsafe scene could put you and the victim at further risk. For instance, if someone collapses in the middle of a busy road, your first action is to protect yourself and others from traffic before approaching the person. Always prioritize safety for everyone involved. Question 3. What is the recommended rate for chest compressions for all age groups, adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question highlights a universal guideline for high-quality CPR across all age categories. The recommended rate refers to the speed at which compressions should be delivered. Whether you are performing CPR on an adult, child, or infant, the goal is to provide compressions at a rapid pace of 100 to 120 compressions per minute to maximize blood flow to the brain and heart. Think of the beat of a fast song to help keep your rhythm. Maintaining this consistent rate is essential for effective CPR. Question 4. After performing initial chest compressions, what is the correct technique for opening the airway of an unresponsive adult who is not suspected of having a neck injury? A. Jaw thrust maneuver. B. Chin lift only. C. Head tilt, chin lift maneuver. D. Placing a pillow under the head. Answer: C. Head tilt, chin lift maneuver. This question assesses your knowledge of basic airway management techniques, specifically for an adult without a suspected neck injury. The phrase "not suspected of having a neck injury" is a key clue, as it guides you to the safest and most effective method. The head tilt, chin lift maneuver gently lifts the chin while tilting the head back, which moves the tongue away from the back of the throat and opens the airway. This simple action can be life-saving by allowing air to pass freely, similar to how stretching your neck back can make it easier to breathe deeply. This maneuver is your go-to for opening the airway in most adult collapse situations. Question 5. When should you activate the emergency response system, call 911 or your local emergency number, for an unresponsive adult victim? A. After 5 cycles of CPR. B. Immediately after determining unresponsiveness and no normal breathing. C. Only after an AED arrives. D. After assessing for a pulse for 30 seconds. Answer: B. Immediately after determining unresponsiveness and no normal breathing. This question emphasizes the critical timing for calling for professional medical help in an adult emergency. The keywords unresponsive adult victim and activate the emergency response system direct you to the urgent action needed. For an adult who collapses and is unresponsive with no normal breathing, the priority is to call 911 or activate EMS immediately, even before starting CPR, unless you are alone and caring for a child or infant. This ensures that advanced medical care arrives as quickly as possible, giving the victim the best chance of survival. Think of calling for help as the first vital link in the chain of survival. Question 6. What is the recommended compression depth for a child, approximately 1 year old to puberty, during CPR? A. About 1 inch 2.5 centimeters. B. About 1.5 inches 3.8 centimeters. C. About 2 inches 5 centimeters. D. At least 1/3 the depth of the chest, approximately 2 inches 5 centimeters. Answer: D. At least 1/3 the depth of the chest, approximately 2 inches 5 centimeters. This question focuses on the specific guidelines for chest compressions in children, an important distinction from adult CPR. The phrase recommended compression depth for a child highlights that the requirement is different due to their smaller size. For a child, compressions should be at least 1/3 the depth of the chest, which typically translates to about 2 inches 5 centimeters to ensure adequate blood circulation without overcompressing. Imagine pressing down firmly enough to visibly depress their chest, but not so hard that you might cause injury. This depth provides an effective pump for a child's smaller heart and lungs. Question 7. When using an automated external defibrillator, AED, on an adult, where should the pads be placed? A. Both pads on the left side of the chest. B. One pad on the upper right chest, one on the lower left side below the armpit. C. One pad on the upper left chest, one on the lower right side below the armpit. D. Both pads on the upper chest. Answer: B. One pad on the upper right chest, one on the lower left side below the armpit. This question tests your knowledge of correct AED pad placement for adults, which is essential for effective defibrillation. The adult context is important as pad placement differs for children. For an adult, one pad should be placed on the upper right side of the chest, above the nipple, and the other pad should be placed on the lower left side of the chest, below the armpit. This specific placement ensures the electrical current passes through the heart, maximizing the chances of correcting a life-threatening heart rhythm. Think of it as creating a path for the electricity directly across the heart. Question 8. What is the appropriate action when a conscious adult is choking and cannot speak, cough, or breathe? A. Encourage them to cough harder. B. Administer abdominal thrusts, Heimlich maneuver. C. Begin CPR immediately. D. Give 5 back blows. Answer: B. Administer abdominal thrusts, Heimlich maneuver. This question addresses a common and critical emergency, choking in a conscious adult. The keywords cannot speak, cough, or breathe are key clues indicating a severe airway obstruction requiring immediate intervention. For a conscious adult with a severe choking event, the recommended action is to perform abdominal thrusts, also known as the Heimlich maneuver, which helps dislodge the object blocking the airway. Visualize delivering strong upward thrusts to force air out of the lungs and expel the obstruction. This specific technique is designed to clear the airway and restore breathing. Question 9. What is the maximum time you should take to check for a pulse on an unresponsive victim before starting chest compressions? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. This question assesses your understanding of the critical time limit for pulse checks during an emergency assessment. The phrase maximum time emphasizes the urgency of determining if circulation is present or if CPR is needed. You should spend no more than 10 seconds checking for a pulse because any longer delay can significantly reduce the victim's chances of survival by delaying critical chest compressions. If you're unsure if a pulse is present or if it's too slow, it's safer to assume there isn't one and begin compressions immediately. Swift action helps maintain vital blood flow to the brain and heart. Question 10. When administering rescue breaths to an adult, each breath should last approximately how long? A. 0.5 seconds. B. 1 second. C. 1.5 seconds. D. 2 seconds. Answer: B. 1 second. This question focuses on the correct duration for delivering rescue breaths to an adult during CPR. The phrase "each breath should last approximately how long" refers to the recommended gentle delivery of air. Each rescue breath should be given over approximately 1 second to make the chest visibly rise, which confirms that air is entering the lungs and helping to oxygenate the victim's blood. Delivering breaths too quickly can cause air to go into the stomach, while too slowly can delay critical oxygen delivery. Think of it as a slow, steady breath, just enough to see the chest rise. Question 11. Which of the following is considered a component of high-quality CPR? A. Allowing the chest to fully recoil after each compression. B. Stopping compressions frequently to check for a pulse. C. Delivering compressions at a rate of 80 to 100 per minute. D. Delivering shallow compressions to prevent injury. Answer: A. Allowing the chest to fully recoil after each compression. This question asks about the essential characteristics of effective CPR, specifically focusing on high-quality CPR. Allowing the chest to fully recoil, meaning letting the chest wall return to its normal position after each compression, is crucial because it allows the heart to refill with blood before the next compression. Without full recoil, the heart cannot adequately fill, leading to less effective blood flow to vital organs. Imagine a pump that doesn't fully expand after each squeeze. It won't be able to draw in much liquid. Always ensure full chest recoil for optimal CPR. Question 12. If an infant is conscious and choking but cannot make any sounds or breathe, what is the initial recommended action? A. Administer abdominal thrusts. B. Perform 5 back blows followed by 5 chest thrusts. C. Begin CPR immediately. D. Sweep the mouth to remove the object. Answer: B. Perform 5 back blows followed by 5 chest thrusts. This question tests your knowledge of specific choking relief techniques for conscious infants. The key phrase "conscious and choking but cannot make any sounds or breathe" signifies a severe airway obstruction in an infant. For an infant, the recommended sequence is to deliver 5 back blows between the shoulder blades, followed immediately by 5 chest thrusts on the breastbone, until the object is dislodged or the infant becomes unresponsive. This combination is designed to create enough force to expel the foreign object without causing harm to the delicate infant. Remember the sequence: 5 back, 5 chest. Question 13. Where should you check for a pulse on an infant? A. Carotid artery, neck. B. Radial artery, wrist. C. Brachial artery, upper arm. D. Femoral artery, groin. Answer: C. Brachial artery, upper arm. This question assesses your understanding of the correct pulse check location for infants, which differs from adults and children. The infant context is the key clue here. The brachial artery, located on the inside of the upper arm between the elbow and the shoulder, is the most accessible and reliable site to check for a pulse on an infant. It's too difficult to reliably check the carotid artery in an infant due to their short neck. Gently feel for the pulse with 2 fingers, much like you might feel for your own pulse, but on their arm. Question 14. What is the recommended compression depth for an infant during CPR? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 1/3 the depth of the chest, approximately 1.5 inches 3.8 centimeters. Answer: D. At least 1/3 the depth of the chest, approximately 1.5 inches 3.8 centimeters. This question asks about the specific compression depth guideline for infants, which is vital for providing effective and safe CPR to the youngest victims. The phrase recommended compression depth for an infant indicates the need for a precise, age-appropriate measurement. For infants, compressions should be at least 1/3 the depth of the chest, which typically translates to about 1.5 inches 3.8 centimeters to ensure adequate blood flow while avoiding injury to their delicate anatomy. Imagine pushing down gently but firmly enough to visibly depress their tiny chest. This specific depth ensures effective circulation in a very small body. Question 15. What personal protective equipment, PPE, should you consider using before providing care, if available? A. Gloves. B. Eye protection. C. Mask. D. All of the above. Answer: D. All of the above. This question emphasizes the importance of personal safety and infection control in any emergency situation. Personal protective equipment, PPE, refers to barriers used to prevent exposure to infectious materials. Wearing gloves, eye protection, and a mask creates a barrier between you and potential bodily fluids, protecting both you and the victim from the transmission of diseases. Think of PPE as your personal shield in an emergency. It's always best to use whatever is available to ensure your safety. Prioritizing your protection allows you to safely provide the best possible care. Question 16. What should you do immediately after an AED delivers a shock? A. Check for a pulse for 10 seconds. B. Resume chest compressions immediately. C. Remove the AED pads. D. Give 2 rescue breaths. Answer: B. Resume chest compressions immediately. This question focuses on the immediate post-shock protocol when using an AED. The phrase "immediately after an AED delivers a shock" is the key indicator for the next step. After an AED delivers a shock, the most crucial action is to immediately resume chest compressions without delay, even if the victim appears to respond. Continuous high-quality compressions are vital to circulate oxygenated blood and improve the chances of the heart resuming a normal rhythm. Don't waste time checking for a pulse right away. Focus on restarting the compressions. Question 17. Which of the following is not a sign of an opioid-associated life-threatening emergency? A. Pinpoint pupils. B. Slow, shallow breathing or no breathing. C. Unresponsiveness. D. Flushed, warm skin. Answer: D. Flushed, warm skin. This question tests your ability to identify the specific signs of an opioid overdose, a critical component of modern BLS. The keyword "not a sign" requires you to pick the option that does not fit the typical presentation. Signs of an opioid overdose typically include pinpoint pupils, slow or absent breathing, and unresponsiveness because opioids depress the central nervous system. Flushed, warm skin is generally associated with other conditions, such as fever or heat stroke, not opioid overdose. Recognizing these distinct signs is vital for prompt and appropriate intervention, such as administering naloxone. Question 18. What is the correct hand placement for single rescuer chest compressions on an adult? A. 1 hand on the sternum. B. 2 fingers on the lower half of the breastbone. C. 2 hands on the upper half of the breastbone. D. 2 hands on the lower half of the breastbone. Answer: D. 2 hands on the lower half of the breastbone. This question specifically addresses the anatomical hand placement for effective adult chest compressions by a single rescuer. The correct hand placement is essential for delivering compressions safely and effectively. For an adult, place the heel of one hand on the center of the chest, on the lower half of the breastbone, sternum, with the other hand on top. This ensures that the force of compressions is directed over the heart and large blood vessels, maximizing blood flow. Proper hand placement helps prevent injuries while ensuring the compressions are as effective as possible. Question 19. When should you consider placing an unresponsive, breathing victim in the recovery position? A. If they have a suspected neck injury. B. If you need to leave them briefly to call 911. C. If they are unresponsive but breathing normally and you need to maintain an open airway. D. As soon as CPR is stopped. Answer: C. If they are unresponsive but breathing normally and you need to maintain an open airway. This question addresses the appropriate use of the recovery position, a technique used to maintain an open airway in specific circumstances. The key conditions are unresponsive but breathing normally and the need to maintain an open airway. The recovery position helps keep the airway open and prevents fluids, like vomit, from entering the lungs, which is crucial for an unresponsive person who is still breathing. For instance, if someone is unconscious after a seizure but breathing well, placing them in this position can protect their airway until medical help arrives. Never use it if a neck injury is suspected, as this could worsen the injury. Question 20. In a team-based resuscitation, how often should rescuers switch roles, e.g., compressor to ventilations, to prevent fatigue? A. Every 1 minute. B. Every 2 minutes, or 5 cycles of CPR. C. Every 5 minutes. D. Only when a new rescuer arrives. Answer: B. Every 2 minutes, or 5 cycles of CPR. This question highlights the importance of teamwork and minimizing fatigue during prolonged resuscitation efforts. Switch roles and prevent fatigue are the keywords here, emphasizing the strategy for high-quality, continuous CPR. Rescuers should switch roles approximately every 2 minutes, or after 5 cycles of CPR, to ensure that compressions remain high-quality and effective. Fatigue can quickly set in, reducing the depth and rate of compressions, so regular rotation helps maintain optimal performance. Think of it as a relay race, where fresh energy is constantly brought into the most demanding role. Question 21. You are responding to an unresponsive individual, and you suspect an opioid overdose. After checking for responsiveness and finding no normal breathing, what is your next immediate action if available? A. Start chest compressions. B. Administer naloxone. C. Call 911/activate EMS. D. Begin rescue breaths. Answer: C. Call 911/activate EMS. This question focuses on the immediate steps in a suspected opioid overdose, emphasizing the priority of activating professional help. While administering naloxone and starting CPR are vital, the very next immediate action after determining unresponsiveness and no normal breathing is to call 911/activate EMS. This ensures that advanced medical assistance is on its way, regardless of whether naloxone is available or if CPR is needed. For example, if you find someone unresponsive and gasping, you should immediately call for help before focusing on specific interventions. Calling EMS promptly is always the first critical step after assessing the immediate danger. Question 22. What is the chest compression to breath ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 5 compressions to 1 breath. D. Continuous compressions with no breaths. Answer: B. 30 compressions to 2 breaths. This question tests your knowledge of the fundamental compression-to-breath ratio for single rescuer adult CPR. The single rescuer and adult context are crucial, as ratios can change for children, infants, or multiple rescuers. For a single rescuer performing CPR on an adult, the ratio is 30 chest compressions followed by 2 rescue breaths. This balance ensures that both blood circulation and oxygen delivery are maintained effectively. Think of it as a steady rhythm of pushing hard and then giving 2 quick breaths. Question 23. You find an unresponsive adult victim who is not breathing normally. You assess for a pulse for about 8 seconds and do not feel one. What should you do next? A. Begin rescue breaths. B. Retrieve an AED. C. Start high-quality chest compressions. D. Reassess for a pulse for another 10 seconds. Answer: C. Start high-quality chest compressions. This question describes a classic scenario for initiating CPR, testing your ability to make a rapid decision based on assessment findings. The key clues are unresponsive, not breathing normally, and do not feel one after a pulse check. If an adult is unresponsive, not breathing normally, and has no pulse, or a pulse check yields no clear pulse within 10 seconds, the immediate next step is to begin high-quality chest compressions without delay. This action is critical for circulating blood and oxygen to the brain and other vital organs, buying time until advanced medical help arrives. Question 24. What is the recommended chest compression-to-breath ratio for a child when 2 rescuers are present? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 10 compressions to 1 breath. D. Continuous compressions without breaths. Answer: B. 15 compressions to 2 breaths. This question focuses on the specific compression-to-breath ratio for child CPR when multiple rescuers are available. The presence of 2 rescuers for a child changes the recommended ratio compared to single rescuer adult CPR. When 2 or more rescuers are performing CPR on a child, the ratio is 15 compressions to 2 breaths. This increased frequency of breaths for children and infants is due to respiratory arrest being a more common cause of cardiac arrest in these age groups. Remember, for children in a 2-rescuer scenario, the breaths come more often. Question 25. When should you stop CPR once you have started? A. After 10 minutes of continuous CPR. B. When you are exhausted and cannot continue. C. When paramedics take over or the victim shows signs of life. D. When an AED advises no shock advised. Answer: C. When paramedics take over or the victim shows signs of life. This question addresses the critical decision points for discontinuing CPR once it has been initiated. You should continue CPR until one of 2 main things happens: either trained medical professionals, like paramedics, arrive and take over care, or the victim shows obvious signs of life, such as purposeful movement or normal breathing. You should not stop CPR just because a certain amount of time has passed or an AED gives a no-shock message unless directed by medical professionals. Keep pushing and breathing until relieved or the victim recovers.